Cannabis-induced hyperemesis syndrome, CIHS. Cannabis-induced hyperemesis, CIHS. Cannabis-induced hyperemesis syndrome, CIHS, is a condition characterized by recurring episodes of severe nausea and vomiting, often accompanied by abdominal pain, in individuals who use cannabis regularly. The symptoms can be debilitating and may lead to dehydration, electrolyte imbalances, and other complications. The exact cause of CIHS is not fully understood, but it's believed to be related to the way cannabis affects the body's endocannabinoid system. Some possible factors contributing to CIHS include 1. Cannabinoid receptor activation. Cannabis contains over 100 cannabinoids, including THC, tetrahydrocannabinol, and CBD cannabidiol. THC, in particular, binds to cannabinoid receptors in the brain and gut, which may lead to changes in gut motility, secretion, and sensation. 2. Gut-brain axis disruption. CIHS may be linked to an imbalance in the gut microbiome, which can affect the gut-brain axis and lead to symptoms like nausea, vomiting, and abdominal pain. 3. Hormonal changes. Cannabis use has been shown to affect hormone levels, including an increase in prolactin, which may contribute to nausea and vomiting. Symptoms of CIHS typically include severe nausea and vomiting, abdominal pain, weight loss, dehydration, electrolyte imbalances, fatigue, headaches, dizziness. Treatment for CIHS typically involves a combination of the following. 1. Cessation of cannabis use. Stopping cannabis use is often the first step in managing CIHS. 2. Fluid replacement. Drinking plenty of fluids to prevent dehydration and electrolyte imbalances. 3. Medications. Anti-nausea medications, such as ondansetron, may be prescribed to help manage symptoms. 4. Topical treatments. Applying capsaicin cream or other topical treatments to the stomach or abdomen may help alleviate symptoms. I do not have much experience with that. 5. Gut-directed therapies. Some studies suggest that gut-directed therapies, such as probiotics or gut-directed hypnotherapy, may be beneficial in managing CIHS. 6. Addictionologist to see. 7. Psychiatrist to see. 8. Pastor to see. 9. Primary care to follow her. 2. In summary, Cannabis-induced hyperemesis syndrome, CIHS, is a serious condition characterized by severe nausea, vomiting, and abdominal pain in regular cannabis users. While the exact cause is unknown, it's thought to be related to cannabis' impact on the body's endocannabinoid system, possibly due to cannabinoid receptor activation, gut-brain axis disruption, or hormonal changes. Symptoms can be debilitating and include weight loss, dehydration, fatigue, and headaches. Treatment typically involves stopping cannabis use, rehydration, anti-nausea medications, and potential gut-directed therapies. 3. Will it cause white mirror changes in the seizure activity? Hyperemesis, white matter changes in the brain, and seizure-like activity. Hyperemesis. Cannabis-induced hyperemesis syndrome, CIHS, is a condition characterized by severe, recurring episodes of nausea and vomiting. It's estimated to affect up to 2% of cannabis users. The exact mechanisms behind CIHS are not fully understood, but it's thought to be related to the activation of the body's cannabinoid receptors, particularly CB1 receptors in the brain. This can lead to an imbalance in the body's natural regulatory systems, causing the symptoms associated with CIHS. White matter changes in the brain. Research on the effects of cannabis on white matter in the brain is ongoing, and the results are not yet conclusive. Some studies have suggested that heavy, long-term cannabis use may be associated with changes in white matter integrity, particularly in areas of the brain involved in attention and memory. However, other studies have found no significant effects. More research is needed to fully understand the relationship between cannabis use and white matter changes in the brain. Seizure-like activity. Cannabis has been associated with an increased risk of seizures, particularly in individuals with a history of seizure disorders. This is thought to be due to the activation of the body's cannabinoid receptors, which can affect the regulation of electrical activity in the brain. In rare cases, cannabis use has been linked to a condition called cannabinoid hyperemesis-induced seizures, CIHS, which is characterized by seizures that occur in conjunction with CIHS. Important notes. 1. Individual variability. The effects of cannabis on the body can vary greatly from person to person, depending on factors such as the individual's genetic makeup, the method of consumption, and the potency of the cannabis. 2. Dose and duration. The risk of adverse effects, including CIHS, white matter changes, and seizure-like activity, may be increased with heavy, long-term cannabis use. In summary, while cannabis use has been associated with potential risks, including CIHS, white matter changes in the brain, and seizure-like activity, more research is needed to fully understand these effects. If you're concerned about your cannabis use or experience any adverse effects, consult with a healthcare professional for guidance.